welcome. Thank you so much for joining us tonight for this talk about how to care for fearful dogs. And really thankful to our partners at the Downtown Veterinary Group, and especially to Dr. Dan Smith for taking the time to do this. So Dr. Smith, if you would just take a moment to introduce yourself, that'd be great.
Hi, I'm Dan Smith. I'm a veterinarian who's been practicing in New York City for over 10 years now. I don't necessarily have specialty training in dog behavior, but we'll talk about that a little more specifically and what your regular veterinarian can sort of help you with in terms of your fearful pet. I'm going to focus mostly on dogs, but I will try to put a little bit of cat-related things into the talk as well as I can. Some of it will overlap, not all of it, but I think some of it is worth kind of mentioning at the same time. Just a little disclaimer here. Again, I'm not a veterinary behaviorist, which is a veterinarian who's trained additionally for very severe behavioral issues in animals. And so that's something we'll talk about a little bit more in terms of that being a resource in the future if you need it. I'm also not a trainer, and I'm currently doing training on my own puppy at the same time. And so I'm not great with giving advice in terms of training. I think that's something that you might need to work with a specific trainer towards, who can sort of tailor a program for your own pet. But it is something that can be really helpful. But I do think that it's something to be aware of, that I don't really have the best insight in terms of specific training questions. The last thing as well that I always sort of want to do as a disclaimer is that all dogs are individuals, just like all people are individuals. So what works for certain animals works differently for other animals. And so depending on how their fear or their stress manifests in terms of behavioral issues, it can be very different. Will be required for them can sort of be hit or miss depending on what the situation is. And so this is a pretty broad overview of a lot of different things. So don't think that what I'm saying is going to work for every single situation. And so let's talk about fear and stress. There's a lot of thought in terms of, in the veterinary community and just the animal community in general, that a lot of their abnormal behaviors tend to be based out of a stress or an anxiety or a fear situation that can really lead them to not really wanting to behave in the way that you want them to. And sometimes that can be pretty dangerous or harmful. That can be due to a whole variety of reasons. Some dogs have triggers. Again, I'm working on my own puppy, and trash trucks that tend to be the thing that triggers her when we're on a walk. That can be something that can be due to previous trauma. Sometimes if you are adopting a pet who is from a shelter situation or a little bit older and we don't know what their full history is, that can sometimes have some trauma that can be associated with it. Sometimes I tell people that their senses of hearing and smell and a variety of other things are a lot more sensitive than ours. And so they can sometimes pick up on things that we're not even aware of. And so sometimes they can act stressed in ways that we're not picking up on what those cues are. And so it's something to also be aware of. Some dogs are just not socialized appropriately at certain times of their life, or they didn't get the appropriate training at certain times of their life. So that can sort of lead to some behavioral issues. And some dogs have general anxiety, and they just are a little bit on edge all the time. They're never really quite comfortable in their own skin. So that can sometimes lead to some behavioral issues as well. The versions of some of these fearful behaviors can range from separation anxiety, which tends to be actually one of the more common ones we see these days. I think COVID really changed a lot of people's schedules. There were a lot of COVID puppies that happened during that time. We were seeing a lot of changes in people's schedules as the world tended to open up. And so these puppies who were used to having their people around all the time tended to have a lot more separation anxiety during that time. We also see things like reactivity on walks or when meeting new people or dogs, resource guarding, whether that be associated with food or toys, territoriality. So that can be when people are coming into their territory, whether it be strangers, sometimes even family members, or it could also extend to things like introducing a new pet or even introducing a new baby into the house. That can actually lead to them having territorial behaviors towards it. Sound reactivity, so that includes things like thunderstorms or fireworks, and then just fear aggression in general, things that will set them off for a variety of reasons. And one that I don't think you can quite see on there, it's just I also listed is fear of going to the vet or any travel. Obviously, I don't love being the one that is creating the fear, but it is something that can definitely be a trigger for a lot of animals. And so, how do they manifest? How these fearful and stressful behaviors manifest in the dogs can actually be part of the amount of weight we want to put on trying to break these habits, or how aggressive we need to be in terms of treatment to try to curb these habits. And so they can range from anything from just sort of hiding and being submissive. It can be aggression towards other people, whether it be family members, strangers. Children obviously is a big one that we need to be aware of and cautious about, because of, the children don't necessarily know how to interact with pets, and so we don't want there to be any harm that's caused. Aggression towards other animals, whether it be, again, introducing another animal into the house or meeting them on a street with a walk. And then it also can extend to things like self-harm. I can't tell you how many times I've seen dogs who are stressed because of separation anxiety, and when their owner leaves them alone, they are scratching on the doors until their nails bleed. They sort of rub against their crates or their carriers to the point where they're causing scratches on their noses. Sometimes they will bite themselves or itch themselves to a point where they cause harm or trauma that way. And so it's a variety of ways that, depending on how the fear and the stress manifests in those pets, sort of dictate how aggressive we need to be. If there are risks to the health and well-being of either the pet themselves or family members or other people, then obviously we need to be treating that more aggressively than some of the submissive behaviors that we can maybe try to work on and try to work through. Along with this, as a vet, speaking towards the medical aspect of this, there are some medical issues that can also stem from a variety of fear and stress behaviors. And so for dogs, we sometimes see things like stress colitis, which is just irritation of the colon that leads to a lot of gross poop issues that can be stress related alone. We will see things like itchiness and licking. So sometimes they will focus on certain areas and fixate on certain areas. Licking their paws sometimes can be a stress release, chewing themselves, causing trauma that way. Occasionally we'll see some changes in their thyroid that will lead to some changes in their behavior. And then there's also one that I've listed here called Addison's disease, which is a hormonal imbalance, actually. And it's a lack of production of a stress hormone in the body. And so our body is dealing with stressors all the time. And so the body should have to have the ability to adapt to that and to respond to that. And that if they are unable to produce this hormone, there can be a whole variety of ways that can affect the body. And so Addison's disease is when they are not able to produce enough of that hormone. And so their stress can actually lead to some pretty serious health issues. On the cat side of things, we can sometimes see things like sterile cystitis, which is inflammation of the bladder. So they will have urinary accidents. Sometimes there's blood in the urine. They'll sort of pee in places they're not supposed to. That can be a stress related thing. Some cats will have upper respiratory infections that will develop. They'll get really congested and sneezy, sometimes from stress. We see that really frequently for animals first coming home from the shelter. They are stressed in a new environment, and so they oftentimes are coming home sneezing. Sometimes it affects their eyes as well. For cats, we'll sometimes see over grooming, so they'll actually lick themselves bald in certain areas, sometimes all over the body, sometimes in certain patches. And then also with cats, we'll sometimes see thyroid changes that will lead to some behavioral changes. So as a vet myself, we can help you parse sometimes the difference between some of the symptoms that we're seeing, if they are medical related that we can treat with medication, or something that can be resolved, or is it something that we need to really focus on breaking some of these stressors or these fearful behaviors so that they don't get into these more critical or severe medical conditions. We should also be mindful of how to read some of the cues that our little pups will tell us. And so some of them are obvious. Obviously, if they're growling or barking or lunging, those are the most aggressive and most severe versions of it. But sometimes it can be a little more subtle in terms of the symptoms and the signs that they will show us. So this is a little cartoon I found that shows sometimes just a little bit of cowering. It can be slight to a pretty severe version of things. Some dogs who are in stressful situations or are unsure what to do, they will do things like lick their lips. Sometimes they will pant in certain ways. I also see, it's not listed on here, sometimes they'll kind of scratch themselves in a stressful manner. It's like an itchiness that doesn't seem to have a purpose. It sort of doesn't seem that they're actually itchy. They just start to scratch in certain ways. Sometimes they will lower their ears and sort of give a stranger look that they're unsure of the situation. They'll move slowly. They'll act more sleepy, or they'll be hyper vigilant. They'll actually be very reactive to anything that's going on around them. Sometimes with dogs that are super food motivated, when they are very stressed, they won't even take any treats, and that's always a red flag to me that they are on high alert and not willing to enjoy their probably favorite pastime. Some of them will pace around, some of them will try to shy away from you. And so little kind of hints and tells will sometimes suggest that we are in a highly stressed or agitated state, and we need to be a little more cautious in terms of how we approach them or how we want to manage some of their symptoms in terms of that. So cats use their tails as sort of signal flags for what's going on. And so obviously a puffed tail will suggest they're not very happy. They'll tuck their tail, as will dogs. They'll tuck their tail when they're not happy with a certain situation. Cats will also sort of tick-tock their tail back and forth when they are agitated, or kind of slap their tail on the ground. They also will change the conformation of their ears or hiss or give you some warnings in terms of that. Cats sometimes don't give a lot of warning before they tell you that they're displeased with everything, but sometimes if you can read their body language and some of the signs that they're trying to tell you or try to advertise to you, you can take some precautions that way. So how do we approach these situations? Obviously, our friend is showing us signals that we are stressed and we are agitated, that we are fearful. And so we definitely don't want to compound that. We don't want to work against ourselves. We want to make them feel a little bit more comfortable. And we also want to be able to interact with them in certain ways. And the first point is to sort of take a step back and give the dog some room. Some dogs, especially in certain situations, might feel like they're cornered, and that can definitely lead to some fear. And so you don't want to crowd them further. Move slowly and purposefully, sort of advertise your own intentions in that situation so that they are not caught unawares and can be reactive to that. Try to use a calming voice. If you are yelling at them or trying to break some of their habits, it can lead to more stress. There's a lot of thought these days and a lot of research that have been put into it that we're trying to move away from the sort of Caesar Milan attempts of things where it tends to be trying to break habits and trying to assert your dominance over them. That's not recommended. That actually just leads to more stress, that they will do certain actions in terms of trying to avoid the consequences of what those actions might be, as opposed to wanting to do them and wanting to interact with the person. So it actually can lead to more behavioral issues down the road. So obviously, if we can do things in a calm way, in a calm manner, that can actually be really helpful to them. If you can, obviously, if there's a dangerous situation, you might have to move quickly, but try not to grab for them quickly, move towards them slowly, so that they don't perceive that as a threatening manner. That way they're less likely to react with their mouth. Offer your hand to sniff and approach I actually usually recommend approaching from below, because if you actually try to go to pet the top of their head, it's a hand coming directly towards their face, and they oftentimes can be reactive to that, shy away from it. But if you offer your hand for them to sniff first, they tend to be more amenable to that. Obviously, just be careful in that situation as well. And then treats can also be very helpful in a lot of these situations, especially for most dogs. I am putting a note in here for cats. Cats obviously are a different situation. They tend to be indoors only, so their interaction with other people. They are also, I apologize for my cat yelling in the background, by the way. They are a little bit harder to approach occasionally. I like to say that cats have 5 weapons, which are both their mouth and then all of their hands, whereas a dog only has 1. So you have to be a little more cautious with cats. But one of the biggest things that people ask me in terms of stressful situations for cats is for travel or even bringing them into the vet. We'll talk about some of the options in terms of medications in a moment, but usually one of the things I recommend for owners is leave their carrier out for a few days prior, if you can. I think it's something that they can adapt to it. They can sort of explore it a little bit, sometimes putting treats or catnip in there so that they will want to investigate a little bit further, maybe get some rewards out of it. Because if you only take out the carrier when you are traveling or when you are going to the vet, they're going to start to associate the sight of that carrier with a super stressful situation. And so it's something just to be aware of, and something, if you leave it out a little bit longer, might make your life a little bit easier. How do we work on these behaviors? How do we try to break some of the stressors? And as I said at the top, I'm not a trainer, but oftentimes starting with work with a trainer who can get to know your dog, who can get to know the situation, who will probably ask you a lot of questions about what the triggers seem to be, what seems to set your dog off, and what your goals are. They can really help give you some guidance in terms of how to approach the situation, how you might want to adapt your routine around them that might help break some of these behaviors and might help give them a little bit of relief. Because honestly, dogs like consistency. They like knowing what's going to happen. They don't like that anxiety of not knowing what's around the corner, or what the next steps are, or what's expected of them. And so if you can create good habits with them, and have some consistency, I think a trainer can be a really good resource in terms of that. And again, if as you get to know your dog, if it's a new dog or if it's something that is a new behavior or something that's been going on for a really long time, you can start to recognize maybe what those triggers are. So I live in a city. There's a lot of different kinds of triggers that might be here in terms of sound or smell or interactions on the street that might not be quite the same as a suburban dog. And so there's a lot of variety there. You get to know your dog a little bit better. And so you can make some of those calls there. If there are ways to avoid some of those triggers, great. If it is something that there's no way to avoid it, then it might be all about slow exposure and desensitization, just getting them to a place where they only have small interactions with those triggers, get rewarded for it, try to control the situation so that they don't feel stressed about it. And then you can start to work towards breaking those habits. And again, a trainer can be really helpful in terms of that. As I said earlier, we're trying to move away from the Cesar Millan sort of protocol in terms of dealing with this. And so we really recommend positive reinforcement. If they do something that you don't like, then don't yell at them, don't scold them, try not to punish them if you can. But when they do something that you like, give them reward, whether it be treats, whether, some dogs just like the attention and pets during that time. So give them a lot of that during the times that they give us the good, positive behavior that we like, so that they want to keep doing that. And that's really, it's hard, but it takes some time, and it is something that will eventually work. For some dogs, it's also about socialization. So the more people that they can meet, the more dogs they can interact with and have those good experiences and reward them during those experiences can sometimes also break some of those fearful responses to those people and animals. And then depending on the dog, depending on your situations, sometimes crate training can be really helpful. Dogs are den animals. So some dogs like to have a safe place that they can go back to that is calm and quiet, is a place that they aren't put when they are being punished, but is a place that they go to get rewards, get treats, things like that, to make it a high quality, a high reward area that they feel comfortable in, that they can hide in. If they need to, they just have their own room to go to. And so some dogs really respond well to that. So it is something to consider if you haven't. I was talking to a colleague, and she asked me to sort of also mention introducing new babies and pets. That's something that can be a little bit of a dicey situation in certain scenarios, but usually if you can keep them separated at first, that's the best way. And then try to introduce things to the dog that was already there, whether it be something that is smelling like the new baby or the new pet, so that they can get their smell and get their scent and get a sense that there is this new person or pet in the area. And then start to have some supervised interactions, very brief at first, and slowly work up to it. Eventually, they will hopefully get along and get to know each other. But I think it's something that you have to be really cautious at first, because introducing them immediately can sometimes have some consequences. So you have to be a little cautious about that. Sometimes it moves very smoothly. sometimes it takes a little bit longer. And so, at least for dogs, there are a few products that I can sometimes recommend that can help. For walks specifically, there are things like the Halty or the gentle leader or a transitional leader. And those are ones that have a little loop over the snout. And that just allows you to have a little more control on them when you are walking them down the street. That way, if they are reactive or if they lunge or if they try to go for something, it actually just diverts their attention away from wherever they're trying to go. So it really will help break the cycle of them trying to lunge towards something or away from something. It just allows you to just divert them a little bit. It's not something that is tight or painful. They can still open their mouths and yawn and things like that, but it will, at some point, they'll realize that they're not getting to what they're trying to go for. Thunder shirts, those are just compressive shirts that you put on the dog, and you can put around them. That can help sometimes with a little bit of low-lying anxiety. It doesn't work with every dog, but some dogs, they feel a little more comfortable. They have a little more pressure on them, and it calms down some of those jangly nerves. And then the last one I sort of mentioned, and this is in more extreme situations, are basket muzzles. So I don't actually really love muzzles themselves that you put around the mouth, because for some of those, depending on the size, they really can't open their mouths, they can't pant, they can't drink water, and so that can cause some issues that way. Whereas a basket muzzle, it's placed over the mouth, they can open their mouths, they can pant, but they can't quite get to anything. And so basket muzzles can be really helpful for those dogs that can nip or bite. It also can be really beneficial. I sometimes have owners put that on for those dogs that are known to eat everything off the street. As vigilant as you are, they are close to the street, they are very quick. And so for those dogs that are just chronically eating things that they're not supposed to, sometimes putting a basket muzzle on a walk can be something that, again, they can try for it, but they won't be able to get anything. The things that I try to avoid and I recommend against are shock collars or those citronella collars that will sort of spray a scent in their face whenever they are barking or doing things that you don't like. Those actually cause more anxiety in the long run. They can sometimes be fearful of it, and they can be more cautious around certain situations. It can break some of the behavior, but at the risk of causing more anxiety and stress on them in the long run. So I think it really is not helpful. Prong collars are the same way. They can actually be restrictive. They can cause some injury to them. And it can also be painful. So it can, just like the shock collars, end up causing more stress and fear in them. And then the last thing I really recommend against are the retractable leashes. The problem with those is I've heard too many horror stories of the brake button on it not being strong enough or breaking in those situations where if they are fearful, if there is a trigger, say a loud noise or something, that they can run away, and the owner just doesn't have the ability to get enough control over them. So I've heard of dogs running into the street because they're fearful, unfortunately getting hit by cars, or running towards another pet where they are lunging towards them because they are getting fear aggression, and the owner just doesn't have the control in the same way. And so I feel like the retractable leashes, while it gives them some autonomy that we sometimes want to give them, it also means that we are losing some control over them if they are put into a situation that we can't control. So I really recommend against those retractable leashes. I've just had too many horror stories about that. Move into my area of expertise in terms of management. Again, your vet can help you parse a few of the triggers that might be going on if there is a medical condition that's going on that is leading to it. And mentioned earlier that there can cause diarrhea in some dogs, that stress colitis. I had a situation, I have a pet where I'm managing that had chronic gas pain that was making him really grumpy, that ended up causing him to be very reactive and biting the owner. And so we were able to manage that, and he's much happier. And so sometimes it's about kind of figuring out what works for each animal. And so working with your vet can sometimes rule out some of these behavioral issues that are medically related. But when we are talking about the medication side of things, I talk to people about two classes of the ways that we can start to approach it if we want to add things other than training on top of their situation. So I talk about the supplemental route. And so there's a lot of different supplements out there that approach stress and anxiety in a lot of different ways. The fact that there are many of them tends to be one of those things where you need to do a little trial and error. What works for some dogs can be very effective. What works for some dogs doesn't work at all for another dog. Sometimes you have to layer them on top of each other because they all work a little differently. So the first one that I mentioned are pheromones. There are collars, there are sprays, there are plugins. And essentially what these are synthetic versions of a hormone that is actually a hormone given off by a mom dog. And so a lot of dogs can be responsive to it because they remember a time when they were safe and happy and young and such. And so some dogs can be really responsive to that. And so I actually really like the collars because it creates this little cloud that follows them around all the time. It's not something you can smell, but it's something that keeps following them around. The plugins are great for if they're at home at times, but if you're taking them on a walk, they won't have that pheromone with them. So I think the collars can be really helpful for that. There are things like calming treats. And so the first one I mentioned here is something called Soliquin, which was something that was actually recommended to us by a behaviorist that we work with, where it has certain milk proteins and a few amino acids that some studies suggest can actually be helpful in terms of stress. Zilkine is another product. It's a supplement that has some milk proteins and a few other things that can be helpful with stress. But the other one that I mentioned here is a little bit of a weird one. So it's called Calming Care. It's actually a probiotic, but the way that it works is it actually increases the overgrowth of a certain bacteria in the gut, which is a good one, but it actually creates a hormonal release in the body that can help break some stress. So some dogs respond to that really well. The last one I mentioned here are CBD products. So there's a lot of new products on the market there, whether they be treats or oils or chews. CBD, anecdotally, I have some owners who have tried it and feel that there are great improvements. I have a lot of owners who have tried it, felt that there was no improvement. The one thing that I put a little asterisk here is that because of what it is, there's not a lot of research associated with the CBD products at this point. There's also not a lot of oversight with the CBD products at this point, and there's not a universally accepted dosing for it. And so it's still up in the air in terms of that. But again, anecdotally, I've had some owners who feel like there's some improvements, so use it with precaution. I didn't put it on here, but I was actually reading a medical article right before coming into this session where they were also talking about, they studied things like melatonin that can sometimes help with some stress, and even doing some melatonin right before a vet visit can sometimes help a little bit of anxiety relief for them. And then kind of going up a level from there are actual medications. And so in terms of actual medications, I tell people that there are two classes that we talk about. So the first one are short acting, or what I call situational based anti-anxieties. And I use these more often for obvious stressful events, whether it be travel, giving a dose of it a few hours before going to the airport, whether it be thunderstorms, if we know that the forecast is telling us that there's going to be a really bad thunderstorm coming on a little bit later in the day, or say it's 4th of July and we know that there's going to be fireworks that are going to set off our pup. Giving a few of those doses right beforehand can oftentimes calm them down so they never get to a point where they're so stressed. But then also vet visits, it's sometimes my best friend using some of these medications, because if your friend is stressed and anxious and on edge, oftentimes I'm not getting the best exam on them. Oftentimes, if we have to do some treatment on them and they are stressed, whether they are trying to get away from us or if they're showing signs of fear, aggression, it can make it difficult for us to treat appropriately. And we also want that experience to be a good one for them. And so we want to use that to our advantage. I oftentimes will, if I see a new pet that I've never seen before and it comes in and it's really fearful and we can't really get a good exam the first time that we see them, if it's not an urgent situation, I often say, here's some drugs, come back another time, let your pet calm down, try giving it on a normal day, see how they do. But then right before you come back, let's do a dose right before you come in. And that way, maybe the whole situation will be a little bit easier and they won't have poor association with how everything went at the vet. And oftentimes I find those dogs and those owners that are willing to try that everything kind of just goes a lot more smoothly. And so there's a variety of them that we use, things like trazodone and gabapentin. There's one that's called Soleo. This can also be true of cats. And so I'd use that oftentimes in cats as well. There's different dosings that we use depending on their level of stress and fear. But I think it's a great option. And for some animals, every once in a while, if we know that there's people coming over as well that stresses them out, you can give them a dose. And it's a great one for short-term type things. However, if you are dealing with a pet who has chronic issues, something that they feel like they are uncomfortable in their own skin more regularly than not, or you are worried about them causing self-harm, then sometimes we are talking about long-term medications, things like Prozac. There's a few other ones that we use with some regularity. Those are a little bit harder. Those tend to take several weeks before they really kick in and before we know if they are going to work appropriately. Sometimes it requires a little bit of dosage changes as time goes on to see if there is any further improvement. And some dogs, just like humans, we'll try them on one medication. We go down that road for a few weeks and we find that there's no improvement, at which point we need to try a new one, which means that we're starting the clock over. And so it can be a bit of a process, but it is something that if we can get them to a place where they are more amenable to training and feel more comfortable in their own skin, then we can really make some gains that way. And I've actually talked to a lot of trainers who, for those dogs that are very stressy and they are so worked up to the point where it's hard to get them to a point where they're listening to you for training, sometimes using some of these drugs to bring them down a level where they are calmer, they're actually more willing to learn. They're more willing to take on some of these recommendations that we do and some of these training exercises with them. So we actually can make more headway. And in some of those situations, we can actually potentially get them off these medications eventually, because if we are getting them to a point where we can actually train them appropriately, then maybe they actually feel more confident and they are more likely to follow our recommendations and our commands. So maybe we can get them off the medications. So it's just something to be aware of. So that's sort of oftentimes what we do in terms of vets to help figure out what situation in terms of medication might work for them. One of the things that I recommend is actually working with a fear-free certified vet. So that's a certification program that we go through. It's not required, but it's something that allows us to approach our protocols in our offices and in our hospitals to try to bring their fear levels down. That includes things like avoiding scruffing cats, which can be super stressful for them. Oftentimes leaning on some of these short-acting medications to bring their stress levels down for these high-stress situations. It's all about handling. It's about creating an environment in the hospital. So see if your vet is fear-free certified, or even ask them. I'll give you a resource in just a moment that you can actually look up and search for fear-free vets in your area. And then the last thing that I mentioned here is the potential of working with a behaviorist. So a behaviorist, again, as I said at the top, is a veterinarian who is more specialized in terms of extreme behavioral issues. They really can create a much more fine-tuned protocol in terms of treatment. They oftentimes are more versed in terms of the pharmacology that's associated with some of the medications, so they can, based on the very specific situation for your pet, really create a plan and a cocktail in terms of medications to help manage some of those situations. So that is a great resource. They are unfortunately few and far between, so it is something that sometimes can be a little bit difficult to get an appointment with them, or depending on where you are. But I will also give you a resource in just a second. But it's something in more extreme situations that are really hard to manage, or if you're worried about harm, whether it be to people or to the pet itself, something that is a great resource for that. So that's about it. That's most of my talk. It's pretty generalized. Again, it's not really specific to any specific situation. These are the resources that I wanted to offer you. The first one is the website of the College of Veterinary Behaviorists. So these are all the veterinarians who did that extra training. And so you can look up in your area if you need one of them. They give you resources in terms of all of that. The second one is a Society of Animal Behaviorists. So this is a society of PhD doctors, also veterinarians who who have a high interest in behavior and training type things. So they are a great resource in terms of kind of taking it up a level. There's also a council for professional dog trainers that I think there's just extra certification. They go through additional courses. So if you want to find one in your area, that can sometimes help, that you just know that they've done a little extra training. The Fear Free Pets website, that's the one that allows you to search for fear-free certified vets in your area. Ohio State University, the vet school there, has a great resource in terms of just some generalized, more specific things to help in terms of stress and behavioral issues for dogs. Their cat one is actually great. I think it's a little bit better than the dog one. It has a lot of different situations, so it can help you create a good environment for them. And then the last one is the website of Dr. Sophia Yin, who was a great behaviorist who's no longer with us, but she created a website that has a lot of information on it. I think it has, since her passing, transitioned more to a publishing company, but it actually does provide a lot of different books, and I think there's a bunch of YouTube videos in there that can help with certain situations. They can give you some guidance that way. So I think some of these are good resources that you can look into a little bit further depending on the situation. Thanks for coming.
Do you have tips around fear with car rides, noises?
It's hard for, again, I live in an urban environment, so there's a lot of noises that you can't plan for. You don't necessarily see coming, can be around the corner. So those are really hard. For stress with travel, including cars, and this might be something to have a conversation with your vet, sometimes that actually can be something as simple as motion sickness. So some pets, they get sick in the car. I suffer from motion sickness myself. And so they feel sick every time they get in the car. So they are stressed about going in the car. They know they're going to feel sick. So sometimes it can be a little bit hard to know and parse the difference. So sometimes we will either try some of those short acting medications where you give a dose an hour or two before you even get in the car. Sometimes we'll try some anti-nausea medication in them to see if it gives them a little bit of relief. Again, some of these can be discussed with your vet to see if there's any options that are going to work for that. For the sound training type thing, that's a little bit harder, whether or not this is something that you can work with a trainer with, or if it's something that having them on a more long-term steady state of a medication so that they are not as reactive, so they are not as hyper vigilant and worked up about things, can sometimes kind of bring them down to a level where maybe we can get them off that medication eventually.
Just as a follow-up, Nicole wants to know, like an anti-nausea drug like Gravel or a dog form. I guess Gravel is the human drug.
Oh, I don't know that one specifically. The one that we use oftentimes is called Serenia in animals. We try to avoid some things like Dramamine. We do use Zofran, which I know is a human thing. The dosing, I would definitely recommend talking to your vet about, because it can all be very different in terms of depending on how big your dog is. Sometimes human medications, we end up dosing way higher than you expect or way lower than you expect. And so I really think before you use any of your over-the-counter medications, definitely have a conversation with your vet so that they can figure out the appropriate dosing for them.
So it sounds like Gravel is the Canadian version of Dramamine. So
Thanks, Mom.
I was just gonna shout her out, but yeah, thank you for chiming in. At what point do you move on from your veterinarian to a behaviorist?
I think that it depends on how far you've gone. I think that depending on the situation, there are some situations where I'll see a dog and say, if you're willing to take it up a level, let's just go there immediately so that we can try to break this as quickly as possible. And I think those are situations where someone's at risk, whether it be a child in the house, whether it be them causing self-harm to themselves, and that is so severe that we really want to break that as quickly as possible. Sometimes it is working through some medications and trying to adjust some things or ruling out some underlying issues. So oftentimes before I'm starting any long-term medications, I usually recommend doing some blood work just to rule out some other medical issues that might be going on, or make sure that they're a good candidate for some of these medications, which oftentimes are very safe. But I think that if you've done your due diligence, you've tried a few things with them, we can't seem to find an issue that is easily managed, then I think at that point it's reasonable to reach out to behaviorists. You can always just take it up that level and go straight to them. But like I said, they are few and far between. They tend to be very expensive for their time because of that. And they will really go in depth for your pet. They're going to be grilling you about every single situation and every single trigger, what the average day looks like. And so they really go in depth for that, and they create a very detailed plan for your pet. And it still takes a while. Like, it's still not an overnight solution for those things. As any of the medications or even the supplements, none of them are overnight. They're going to take some time for them to work and see if they're working. So it can be really frustrating. It can be really difficult, but there are options out there. And so I think that if you feel like your vet is not getting you to the place that you need to be, and you've tried some various things with them, then maybe it's time to sort of take that next step.
I'll just close this out by saying thank you for taking time and, walking
Of
us
course.
through all of this information.